Hi, my name is Eva Thibaudeau, and I am here from Houston. I am the CEO of an organization called Temenos, Community Development Corporation. Temenos is a Greek word for safe, healing space. And what we do is we move people out of unsheltered homelessness, the most vulnerable folks who are experiencing homelessness in Houston, and we move them into permanent housing and offer them supportive services, ending their homelessness forever. So I've said it, I said the H word, which in any Texas city right now and going forward is a hot topic. And I believe it's going to continue to be. If you talk to any resident of a city, if you talk to someone who's experiencing the crisis of homelessness, if you talk to my neighbor, and if you talk to me, or if you talk to our mayors, nobody is comfortable with experiencing and seeing people in the condition and the crisis of unsheltered homelessness. Some people get angry and they call for ordinances and they cry NIMBYism, not in my backyard, that is. Other people go get a social work degree and start working in this for their career. That's me. There are very rarely the in-betweens. Seeing people suffering the inhumanity of unsheltered homelessness, it makes us feel really bad, and it should make us feel bad. However, we have many people who for a very long time, since the rise of unsheltered homelessness in the modern way that we see homelessness has happened since the 1980s, we've had many people who have come up with a lot of different interventions. We have folks who have tried to do programs, folks who had offered food, folks who have done job problems. I think one of the biggest things that I hear right now, despite all the success of things that have been done, is that people in cities are really feeling like there's a rise in the visibility of unsheltered homelessness. There are a few reasons for this. We know in the greater Houston area that our unsheltered homeless numbers have actually gone down in huge numbers from 8-9 years ago. However, visibility is up, and it's always the optics is what people respond to. So we have had incredible urban core revitalization, along with its ugly cousin, gentrification. And that has pushed a lot of people out of places where they had been homeless and where people had experienced homeless for decades, but went unnoticed by the general population. We also did incredible beautification of bikes and trails and our bayou system. Again, that pushed people out who were going relatively unnoticed on unsheltered homelessness into the spotlight and onto the street level. We also have increasing urbanization of our famous Houston sprawl, sometimes known as suburbs. And that also has resulted in urban problems in those communities where they weren't used to having them before. So like I said, people since the beginning of this modern era of homelessness have tried a lot of things. And at the beginning, we really had our best intentions. We went from the heart and we went from the gut, and we tried to do things to help end people's homelessness. Some of it worked and some of it didn't. The great news is that over the last 25 years, there have actually been evaluations. We have evidence-based practices. We know what works. And in the greater Houston area, we have really been very focused and driven to do what works. So what is that? First of all, you have to make sure that you have your data together. For years and years in the greater Houston area, we had this myth that there were thousands of unsheltered street homeless minors, and we could never actually find them and verify that. And to an average citizen or person thinking about thousands of minors who no one can find and they're homeless and abandoned, it was completely overwhelming. People shut down. What we know now is that most of the young people who experience the crisis of homelessness in a given year are probably, and actually go to a shelter or end up unsheltered, they typically are over 18 and they're in and out of experiencing homelessness. It's much more complex than we originally thought, but the numbers are also a lot more manageable. When you know the numbers that you're looking at, you can actually then build a solution that works. So having your data and then being completely data-driven in what you're doing. Data has also given us best practices. And so while we still oftentimes fund and support programs that feel really good in the heart and felt good from the gut, they're not producing outcomes, and they're not producing cost-efficient outcomes. The reality is that with the size of unsheltered homelessness in Texas, we do not have enough resources at the table to give something to everyone. And so we had better darn well be efficient and effective with the ones that we have. So we don't have the luxury of choosing a more attractive but more expensive intervention if a less expensive one will work. Third, we need to work together. This has to be hyper-collaborative work that is supported from our city and county governments all the way down to every provider and the people doing street outreach. If we're not working together and each bringing our best to the game and complementing what everyone else can do, then again, we are duplicating efforts, and it just means that people are going to be on the streets longer. Finally, we have to connect people with income. In Houston, we embedded our workforce solutions, our workforce development one-stop shops into our emergency shelters. For the vast majority of people who experience the crisis of homelessness, it is going to be returning to income that gets them back into stability. And finally, my favorite one is housing first. We need to house people as immediately as possible upon meeting them, because guess what? Having your name on a lease ends your homelessness. After we end your homelessness, we can offer you all sorts of ways to support your tenancy. That might be case management. It might be a nurse practitioner. It might be a peer specialist or a community help worker. With wrapping those types of services and offering that support in a permanent housing setting, we have over 95% of people who we house remaining housed 1 year, 2 years, 3 years after exiting the streets. So we do have solutions, and we do know what works in the homeless response community. However, this is going to remain a race without a finish line, as long as we don't address some of the bigger systemic issues that create homelessness. Homelessness is a symptom of many, many upstream broken problems. It's a system that, it is a symptom of not investing in young, Black, brown, and poor youth and making sure that they have paths to success, not to prison and homelessness. It is expanding healthcare for all so that we can take advantage of that as another funding stream and increase people's health, which increases their ability to live independently and stay off of the streets. We need to address education. We need to provide employment, transportation, all of these things. And the big one is that we have to invest in mental health and substance use dependency services to help families stay together, to help people stay in their communities where they can get the natural supports that exist. And so our takeaway here is that we have solutions and we have tools that will end homelessness for people who are experiencing it now, today. But the greater call to us as Texans of the future is to stop people from flowing into homelessness by affordable housing, mental health care, substance use and addiction, and reforming systems that oppress and create homelessness.